Thank you for your patience, everyone.
Sure.
We're here to present Building Bridges Between Utah's Aging and Disability Networks. So we're going to introduce ourselves and give you a little bit of background, some of our experience, and then we're going to ask you guys a couple questions so we can get to know you. So I'm Jen Morgan. I'm at Utah State University at the Institute of Disability Research Policy and Practice, and I'm the Aging and Disability Program Manager there. I started my career in 2011 at the University of Utah at the Aging and Disability Resource Center. And that was a federally funded program that was funded for 5 years. Every state was eligible to apply for it. And it really was the Administration for Community Living to bring aging and disability networks together. So in Utah, echoing? Maybe the volume's high.
You want me to turn it down?
Sure.
I know where.
Since you just did this. Unless I'm talking too loud, I don't know.
No.
So it really was for the Administration for Community Living to bring aging and disability networks within the state together, to work together to help older adults and people with disabilities to be able to streamline access to care through one point of entry. So for Utah, what we did is we coordinated with area agencies on aging that serve older adults and people with and centers for independent living that serve people with disabilities. So we brought those networks together and did a lot of cross training. We had an annual training just to get to know each other. As the area agency on aging, we call them AAAs, and centers for independent living all cover every county of the state, but they don't always intermingle or even know who each other are. So that was really what the ADRC did for Utah, bringing those networks together. We had a steering committee where we had aging, disability, Medicaid, 211, all sorts of community agencies to meet monthly to talk about this intersection. So once the federal funding wrapped up, some of those activities did kind of melt away. Some are still active in the state. In 2017, I started at IDRPP, and I deal with projects that are focused on aging, disability, veterans, and caregivers. And so I'm excited about this project, this topic, because I just am not sure when a person with a disability may become 60 and may be able to walk through the door of an area agency on aging for resources, if they know that that resource is there, or if the aging network knows how to serve a person with a disability, or caregivers that are aging, taking care of a person with a disability. So I think these are topics. We don't have a big solution here today, but we wanted to get the discussion going and talk about how we might be able to bridge aging and disability.
And I'm here, Libby Oseguera, and I'm the Executive Director for the Utah Developmental Disabilities Council, excuse me. I've been with the council since 2012 and have been in the role of the director since 2018. And although the council primarily serves individuals with cognitive disabilities, I'm going to be talking about disability more broadly today. But this is a topic that's particularly of interest to the council because we serve individuals throughout the lifespan, and people with disabilities are living longer than they ever have before. And it's very important that we're able to support people as they age. And currently, and honestly, we're not really doing a great job of that. Also, aging and disability service systems have very similar and parallel services and workforce needs that also need some attention. And we really want to have conversations about how we can improve services and supports as people are aging, and the way that we can improve those, as some of the things that have been done that Jen was talking about, and how we can work through some of the things that perhaps you're doing in your work life or your personal life or whatever brings you here today. So we're excited to have this conversation with you. And also, as mentioned, we don't necessarily have answers or a model or something wonderful that you're going to walk away and be like, oh, we can go back and implement this. And we're so excited to do that today. It's more of a bringing attention and just awareness to some of the strategies that have been explored and bringing light to where there are some pretty glaring gaps that we can try to close or bridge so we can work our title into this conversation. So we'll just move forward here and just get to know a little bit about who's in this room today.
So we want to know who you all are working with. So how many in the room work with older adults? So say people over 60. Oh, hands up. Okay. Okay, and how about working with people? Okay, so the next question is, so how many are serving both? So it looks like, okay, that's great. Would anybody be willing to kind of do some shout out? I mean, you can say where you are working, but maybe what kind of organizations that you might partner with. I could pick on somebody. I know a few of you in here. Any partner organizations, anything that you guys, does anybody work with area agencies on aging? A couple. And how about Centers for Independent Living? I know this is the last session, but we'll, before we wrap it up, but that's, we'll speed along. Go ahead.
Okay,
Here we go.
okay. So again, really what we're faced with here is this idea that, like we mentioned, these service systems don't really intersect that well. And that's part of the discussion that we want to have today, right? Right now, our systems are siloed and fragmented, and there's multiple agencies at the federal, state, city, county level, and there are a number of different intake processes and reporting systems and assessments and just everything. It makes it incredibly difficult to navigate for not only the systems themselves, but the individuals who are trying to access them. And so we really want to have this conversation on how we can work through some of these kinds of things. So again, we're going to talk about this today, but we're going to do it in a broad sense and open-minded, and we're really trying to focus on the individual that we're serving, right? That is a person who is aging, who also has a disability, and that's the person that we're trying to keep in mind today. And we're going to do that thinking about it in a very broad sense. So let's, what happens if I'm a person, I was born with a disability, and now I have changing needs as I'm getting older? Or maybe I'm an older adult and I've acquired a disability as I age and I need different services now. How do I navigate that? How do I enter into a service system? Or like I said, my needs are changing and maybe the system that I've been working within isn't able to support me anymore. And now what do I do? Who do I turn to? How do I work with all of this? So those are the conversations we're going to have today. All right, so here we go. We're going to use, for the purpose of our discussion, a very broad definition of disability. This comes from the Centers for Disease Control. Disability, as defined here, a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. So again, we're thinking this could be a condition from birth, right? It could affect our cognition. So intellectual or developmental functioning like memory, understanding, thinking. It could be our mobility, our ability to navigate the world around us. It could be vision, hearing, our behaviors. It could be our mental health. So these would be things that we might be born with. Examples of that could be muscular dystrophy, ADHD, Down syndrome, autism spectrum disorder, fetal alcohol syndrome. So these are some examples of things we might be born with. Or we could have an acquired disability. This could be related to an injury or an accident. Perhaps we have a spinal cord injury or a traumatic brain injury. Or maybe it's related to a health condition that we've had some kind of disability related to that. Let's see. Oh, like diabetes, for example. Maybe somebody has experienced vision loss or nerve loss, right? Or even loss of a limb as a related to a diabetes condition. So that's how we're going to think about disability in a very broad sense, right? And as we're thinking about somebody as they're aging, what are some very common disabilities that people face as they're aging? Anybody?
Arthritis.
Dementia.
Dementia.
Hearing loss,
Vision loss.
vision loss.
Mobility.
Yep. You guys, gold stars all around. Okay, so you can see that this, keep thinking about this because this is going to come up again later. It's very broad. Any condition or body or mind that makes it more difficult to navigate and interact with the world around them. Okay, so the last thing that I wanted to just introduce broadly, this data comes from the Department of Health and Human Services, and every year the staff at Health and Human Services randomly calls roughly 12,000 households. And any adult in those random selection of people 18 and older pick up the phone and they answer some questions about their health care, their preventative, and their health behaviors. And of those people who responded to this survey in 2022 and 2023, the captions are covering the data set. Let's go over here. You can see, well, you can't see, but this first set here, these are 50 to 64-year-olds, and the teal color there, or blue, whatever, blue-green, those are the male respondents, and that's roughly 25% of people. And then the purple color there is 29% of people answered that yes, they do have some kind of disability. And then you jump to individuals 65 and older, and you've got male respondents over 40%, right? Looking like 42%, and then female respondents at 41%, saying yes, they do have a disability of some kind. Again, these are random individuals, Utah households that self-identified as having a disability. That means they said, yes, I do have a disability. And that's going to come up again later as well. So.
Okay, so just to do a little background on aging, and I'll say I'm talking about the Aging Network. There are a lot of, I'm really talking about area agencies on aging. There are a lot of other organizations that would be in the Aging Network, but that's what I'm talking about today. So the Older Americans Act was established in 1965, and in 1973, the area agencies on aging came to life. And they were set to be the on-ground organizations charged with helping vulnerable adults live with independence and dignity in their homes and communities. So a lot of, home community-based services. And so every state has area agencies on aging. And they are funded through federal money that comes down into the states to the area agencies on aging. And sometimes they send that out to local service providers. They also use additional funding because they do way more than just the Older Americans Act. And so they use revenues from state general revenue, Medicaid, local funding, and other state funding. And so Utah's area agencies on aging serve service resources and programs for older adults 60 plus. So I'm going to show you guys a video that was developed a couple years ago that will tell you exactly what the area agencies on aging do in Utah. I love it because each director takes a segment so you kind of see the faces. We have 12 area agencies on aging throughout the state, and they either provide oversight or they run the senior center as well. And so if you go to the next slide, hopefully this will work.
On the computer.
Also, there's this tiny picture in this picture.
It's not on that one.
Should we do this
Yeah, that one.
and then turn it up?
Administer a wide variety of home.
Here we go again.
I'm Rob Entz with the Utah Commission on Aging. Area agencies on aging administer a wide variety of home and community-based services for older Utah residents. These agencies are primarily responsible for a geographic area, also known as a planning and service area, a PSA, that is usually a single county or a multi-county district. They coordinate and offer services to ensure that older adults have the support required to remain independent. Let me introduce you to Utah's agency leaders.
I'm Mary Lucero with the Mountain Land Region. Aging Services offers caregiver support groups, classes, respite care programs, and can connect you with local volunteer opportunities to help you give back to your community.
I am Rochelle Blackham from the Davis County area. Aging Services can help coordinate transportation to critical medical and other essential appointments.
I am Amy Hofsteiser from the Twilla County area. Aging Services manages community senior centers where individuals can engage in a variety of activities, receive meals, and get access to the Meals on Wheels program.
I'm Carrie Schonlaw from the 5-county area. Aging Services offers friendly visiting and telephone reassurance calls to make sure you are safe and connected socially.
Hi, I'm Paul Leggett from Salt Lake County Aging and Adult Services. Aging Services provides information and referral services, including screening and assistance in enrolling in public benefits and helping veterans connect to benefit programs.
I'm Doug Kirkham from the 6-county area. Your Aging Services agency advocates for your safety and rights through education on elder abuse and fraud.
I'm Shauna with Southeastern Utah area. Aging Services can assist you with programs for older adults with the need for in-home services, which includes case management or care coordination.
I'm Cindy Roop from the Uinta County area. Aging Services provides health insurance counseling to help you understand and navigate choices related to Medicare and related health coverage.
I'm Tammy Gallegos from the San Juan County area. Aging Services provides education for healthy living, nutrition, and free health screenings.
I'm Michelle Summerall from the Uinta Basin area. Aging Services can help connect you to the vital support groups, including caregiver, grief, and loss, and Alzheimer's.
I'm Nobu Izuka from Weaver Morgan area. Aging Services provides wellness programs to help you maintain a healthy lifestyle, including nutrition, fall prevention, exercise and strength training, Tai Chi, and other activities.
I'm Carolyn Reed from Bear River area. The Aging Services has an ombudsman program
to protect our elderly that are living in long-term care, assisted living, and skilled nursing facilities.
For more information about services in your area, please visit your agency by clicking on the map or link to your Aging Services website. We look forward to serving you.
Oh. So you might have noticed that some of the agencies might just have one county that they're serving, and some, like 6 County, are right in the middle of a very rural Utah. So I like the video, it gives you an idea of what they do, and working with older adults living in rural and urban Utah. Okay, the next one. So, and Libby talked a little bit about this already. You know, a lot of times area agencies on aging will see a client come in, maybe in a wheelchair and having oxygen with hearing loss. They don't necessarily identify as having a disability. They might say, you know, that they're handicapped. Well, obviously that language is not how it's spoken about in disability. So just having that language, barrier, so to speak. It's like for Libby talking about that survey, you know, somebody's saying, oh, I have a disability. Well, would an older adult necessarily identify as having a disability? So those numbers might be much higher. And then I also worked with veterans that may have acquired disabilities through their service. And a lot of times they don't always integrate with the disability network. So they're just kind of hanging out there as well, as many of them aren't enrolled in VA. And there's also a gap in data. So the aging network, how they're tracking data, disability types when they're working with their clients is they used to during the ADRC days, but now I'm not sure if they do collect any type of, do you have a disability? I can work on that.
We just wanted to share a story with you to just help articulate what somebody might be experiencing. So there's a person that I've known a long time. She's in her mid-60s now, but this story, she was in her early 50s at the time. She is an adult with a developmental disability. She lived with her parents who were in their 70s, and her mom was the primary caregiver for her and her dad. And all of a sudden, her mom dies. And now she, who is an adult, is now the primary caregiver for her father, whose health is declining. And she can do most things independently. She needs a little bit of support with, you know, food prep and shopping and these kinds of things. But her dad was reliant on mom for meal prep, most activities of daily living, bathing, toileting, meals, everything. So now Kay, we'll call her Kay. That's not her name. I'm protecting her identity. She's doing all of these things for her dad. And mind you, she also needs support with a lot of these things. And so now she has lived most of her life using the disability services for her own support needs. And now she's the primary caregiver for her father, who's aging and has pretty high support needs himself. And her parents had not ever sought out any kind of supports for her dad because mom was doing it, right? But now what do they do? Because Kay's really struggling to maintain just a household as an independent adult, doing most of these things that she needs support with, and being a full-time caregiver for her father, who needs a lot of support himself, and trying to figure out these new responsibilities that she has, paying bills and budgeting and grocery shopping and meal prep on top of all the other things that she's trying to navigate. So she goes to the people that she thinks can help her. Her service provider, her support coordinator, all of these professionals that she's been working with to support her needs, her own needs that she's, worked with for years, and they can't help her. I'm sorry, you'll need to help your dad apply for his own services with this different set of providers in a different service network, right? You need to seek out aging services. You need to go to, you need to call the senior center, call the AAA, right? Sorry, the Area Agency on Aging. Reach out to this group, reach out to that group. This is all very frustrating for her. She, again, has a developmental disability, which makes it difficult for her to navigate applications. She needs help, and she doesn't have access to it. So this is a very frustrating thing that happens to a lot of people. So this is the kind of story that we're talking about when we want to make sure that our systems are better designed to prevent this situation. That it all worked out okay for Kay and her dad. She lives independently now, and he got the care that he needed, but that's not true for everybody. So anyway, just wanted to share that with you.
Okay, so service gaps and data, we talked a little bit about that. I meant to mention on that last slide, that another service that who's here today is the Utah Assisted Technology Program. I don't know if you guys got to see their booth. And yes, shout out. That's an example of a program that can help people with disabilities and older adults. If you saw a lot of their items, there's a lot of things that maybe an older adult with vision or Parkinson's could tap into that. But a lot of the area agencies on aging don't know that UATP exists. So, we've been working with that program, trying to bring them with us to rural conferences with Aging Network and caregivers to let them know that that program's out there. So again, it's like there are ways that we could intersect, but it almost takes someone to kind of orchestrate it to happen and kind of connect the dots. So back to what I talked about a little bit about back when we had the ADRC, we were very specific. We had agencies asking what type of disability, from TBI, cognition, IDD. And then once that funding went away, I think that just kind of, they decided they don't want or need the data. And then how do we collect it if the person doesn't report it? And I would say on the aging side of things, then they kind of were in this kind of let's check the box to ask them all those questions. Do you have a mobility issue? Do you have this issue? Do you have, which was not very person-centered. So we did a lot of training with aging to kind of have those motivational interviewing engagements, person-centered planning to make sure that, what do you see? What can you come up with in your just interaction with this individual? And then again, working with a lot of caregivers, I don't think Aging Network is really asking when they're working with their caregivers, who are you caring for? Are you caring for somebody with a disability? Possibly when they're in the caregiver support groups or activities, maybe they're talking about it there, but they're not recording the data. So that's some of the gaps that I see in the Aging Network, at least in my work with them.
So some of the information that we wanted to make sure that you were aware of and had access to are some of the things that are available to you coming from the federal level. And that's through the Administration for Community Living. I'm not sure how many of you are familiar with that, maybe just like a little. Okay,
ACL, anybody know?
Okay, cool. All right, we got a couple.
Noreen's like, yeah, I know this.
Anyway, the Administration for Community Living is through the United States Department of Health and Human Services, and they're designed to help people with disabilities and older adults engage in community living. And I know that sounds like, okay, I get that. So people can stay in the community. Why do we even need that? Well, historically, that's not what we've done. for people with disabilities and older adults. That's kind of a new idea, right? People with disabilities and older adults, they go to the old folks home, or people were put into institutional settings, and that is not what we want to see. We want people to be able to remain in community settings, age in place, at home, in the setting of their choice. And the Administration for Community Living helps with resources and information and funding to continue to have resources for people to be able to do that. Some of the things that will help with those kinds of things are data, right? I know it's not the most exciting thing in the world, but having information about who people are, what they need, and trends about their lives, data informs a lot of things, right? So the more we know about people and what they need and what they want, that can help determine where funding comes from and how we spend our federal dollars. And so they've got this Aging, Independence, and Disability Program data portal, which has information about people who are aging and also have disabilities. So I encourage you to look into that information, as well as there's some technical assistance and some data sets about what kind of questions you could be asking to make sure that you're collecting this information. And then they also have all these little green things. These are all hyperlinks. So when you have the slides, you can go and just click it and it'll take you right to all this information. But the national resources to strengthen aging and disability networks, that's the clean little title at the top of the page when you get to the website. But there's a lot of different projects. There are some evidence-based practices and different projects that have been taking place throughout the country. A lot of different resources and things that you can try. So we just wanted you to make sure, that you were aware of these different things that were going on, so that when people are doing different assessments and you're trying to work with older adults or figure out who the community is that you're working with, you have tools to say, you know how to do a motivational interview, right? Rather than saying, do you have a mobility limitation? You can say, hey, do you ever have difficulty using the stairs or getting around in your house? And they might say, yeah. And you can say, tell me a little bit more about that, right? Because if you say, do you have a mobility limitation? The person's probably going to say no, and we're going to move on. But if you ask me if I have a little bit of difficulty navigating the stairs or getting around in my home, I might answer differently, right? So it's just all about how you convey that information, and these kinds of resources and toolkits can help you to do those kinds of things.
So we're gonna give you some ideas, some takeaway, right? But I do want to say at the bottom, we put the question, are good cross referrals and collaborations between the networks being made? So, I mean, how many, so we got an idea of people working with older adults, people with disabilities, and both, how many would say in your situation, in your work life, how many would say that yes, good collaborations are happening? And you can raise your hands. Okay. That's interesting, because some of you said that you work with older adults and people with disabilities. So you guys, that's why you came, right? To figure out how to bridge this, because it's frustrating for sure. Okay, so we're gonna go on to the next slide and talk about kind of some things that some opportunities that I would suggest, if you're not already doing, to build the bridge. And one is being at the table. Join a board or join a monthly meeting. So like the Commission on Aging, they meet every quarter. It's open to the public. It's virtual. You can go to their website. I have it listed at the end of the slide deck. But that's a great way to go and just see what are the hot topics right now that they're talking about in Utah and aging. Reach out, request a training, ask your partner, somebody you kind of want to get to know, to say, hey, is there any way you could come to our organization and provide a lunch half-hour training and just tell us who you are and what you do. That's a great way to start partnership building. When you're planning your annual training, invite your partners, ask them to do a resource table or come and present on what they do. And then we talked about motivational interviewing and person-centered planning. And I think, before we had ADRC in Utah, the Aging Network wasn't really using a lot of that. And I think disability uses it a little bit more naturally. But that again is a way for, hey, let's do a training on these topics and invite aging and disability to the same place. So those are some ideas. I've done a lot of work with veterans and making relationships, the VA, like nobody knows how to get, the key to the VA. And we've been able to develop partnerships between VA and community organizations by a lot of these steps. Training's a great one. Okay, I'll go to the next slide. Okay, so I wanted to talk about just some impacts about bridging disability and aging that we've been doing or that is happening right now. So the EDRC, I will say that there is still some residual work that's being done. With the motivational interviewing and person-centered planning, we had people we called options counselors that did benefits counseling. And a lot of the agencies kept those roles and still call them options counselors. As well as, we've got the Family Caregiver Collaborative, which is funded at the University of Utah. And I think there's 50 different agencies on that collaborative, specifically talking about aging, disability, family caregivers, so all family caregivers. The Utah Master Plan on Aging, it's the first master plan that's ever been written for Utah, and it's including all family caregivers as well. No Wrong Door for caregivers is a ACL, Administration for Community Living grant that was just submitted through the University of Utah that will help, hopefully, if we're awarded a grant, that would be amazing. That would allow us to bring a lot of the organizations, and maybe your organizations work with caregivers, trying to bring a No Wrong Door, where there's one place to access a website, services for caregivers. And then there's a lot of coalitions and work groups that are happening that we want to have representation from aging and disability. So again, if there's someone maybe you don't want to commit like every month forever, but maybe you could just ask like, hey, could I join your meeting this month? Because I want to just learn more about what you're doing. Sometimes you have to knock on the door first. Somebody's got to start. Someone's got to make the first move. So might as well be you, right? Overall, it helps grow the network and it will help you better serve your clients.
Before we go on, can I just?
Oh, of course. Oh, yeah, you can.
Well, I know we're running out of time, but I just want to share a quick success with the Family Caregiver Collaborative that's coming out of the University of Utah. That's been a really awesome project that has some really cool impact that I didn't really expect. Let me rewind, and I'm going to try to go quickly, but they were focused on family caregivers, and again, their focus is on the aging population, and I come from the disability population. But when I was starting to introduce myself to you, I talked about how there were a lot of parallels between the aging service system and the disability service system. And caregiving is one of those huge workforce needs, right? Whether it's unpaid or paid, people are providing care. And that was a common need that we both needed to address. And in 2021, 2022, forgive me, years are all mashed together. We both came together and we needed to address this idea of caregiver compensation, right? If a person was caring for a loved one and they needed to leave the workforce to do so, that was causing a burden on families. They were losing out on income, and they were providing an extraordinary level of care, right? It's much different than looking after your child, or what would somebody consider a typical amount of caregiving. So anyway, I'm getting off track here, but we all came together because we had a common need. And so I think what I'm trying to express is, if you're not sure where to start, think about what your needs are, find another organization or somebody else who shares that need. And that is a good way to kickstart your journey together, right? Our story ended beautifully. We had a big event, and we invited lawmakers, and we had stories about why caregiving was so impactful. And anyway, caregiver compensation got funded, and now people who provide care to their loved ones can get paid to do so. So hooray. But anyway, so that's I'm rambling now, but anyway, find your thing, partner up, right? That's all it takes, is just
That's the only way to bridge it. Like, it's just not gonna, it's just not gonna happen. So we have to be really, we have to participate and find ways where we can build a bridge. Thanks for adding that.
Thanks. It was kind of a sideways ramble. Got it out.
So then we just wanted to add some, I think we're both going to talk about this, but again, you will get this document. I'm sure Eduardo will make sure everybody gets it. It'll be on the website, but we put a lot of links in here, but here are some, obviously the ID RPP. We have a lot of programs that serve and help people with disabilities. And there are 6 centers for independent living in the state. And then I'll let talk about.
Yeah, so if you're not familiar, oh yeah, we already talked about this. Nori knows, so she can help me. Centers for Independent Living also come through the Administration for Community Living, but they're governed by the Rehab Act. That's another thing. There's a lot of different federal laws that offer oversight of all these different services. Anyway, there are 6 regional centers throughout the state, and they have a number of different core services. And then they have additional services based on what that community or region needs. But a part of their core services are different independent living skills, home modifications. So if you need support in, cooking, or you need a ramp to access your home, or you need a shower bar, or you need to borrow a shower chair, or those kinds of things, those durable medical equipment. Those kinds of resources are available through the Centers for Independent Living.
And so, yeah, and you might want to talk about the DD Council. I don't know if people know, everyone knows about the DD Council, but that is also another board that you could get engaged with.
Yeah. So the 20-second pitch, the Developmental Disabilities Council is a governor appointed board. We focus on serving, educating, and advocating for people with developmental disabilities and their family members throughout the lifespan. And again, we're focused on community integrated living, and we do a lot with education and advocacy work. And we're housed within the Utah Department of Health and Human Services. In that link, there's also aging and adult services, and a lot of other division of services for people with disabilities, the disability ombudsman, the aging ombudsman. So they're, if you're not sure what an ombuds is, it's kind of like an advocate, but not the legal kind, more of a I'm in your corner kid kind. So you can help, they can help with complaints, or if you have some kind of support need, then you just need some advice. That's what an ombuds would do for you.
And then I just added the commission. I always have to add something on VA. If you're working with caregivers and veterans, and there's access about the caregiver support program. And then the video I showed, there's the link. And then we've got a couple things that I found in research about education coming up on some of these topics. Of course, you're here and you'll get these slides, but I thought this great, the Center for Healthy Aging and Innovation is talking about aging and disability coming up. And then there's the annual Association of Developmental Disability Conference. Obviously, you're not going to go to Missouri probably, in May, but sometimes I like to look at the brochures and see what topics they're highlighting to see kind of what topics are happening kind of nationally. And then
Okay, we're gonna leave you with this. The future depends on what you do today. We talked about a lot of stuff today. Some of it's still kind of nebulous and really what we wanted you to get from this is that there's not a great systemic approach to moving forward, but we need to do something. You can't wait for a memo or guidance or somebody to tell you what to do. Just pick a thing. If it's improve your training or choose a partner who another organization that has a similar goal to yours. You're going to learn about one of them. Just take a step. Do one thing to improve the way that we're going to support people as they age, because that's the end goal, right? We just want to make sure that people have access to the best life possible, and that's what we're hopeful is that everybody has the best outcomes. And so get out there and do it.
sorry that we ran out of times for with our tech questions or anything, but the slide deck will have our contact information. If you have any questions, please feel free to, if you want to pick our brains or anything, please feel free to reach. Thank you so much for coming.